CHEK Podcasts.
Hey everyone, welcome to Political Capital, your source for all the latest in BC politics. I'm your host, Rob Shaw. Thank you for being here. Thank you for watching us each and every week here on CHEK. A busy week in BC politics. We have a emerging healthcare crisis with doctors speaking out publicly that's put the NDP on the defensive. We also have the Premier taking off for his first international trade trip. We are going to break it all down with the pod squad. The panel is here as usual. Jeff, Jillian, and Allie, thank you so much for being here each and every week to break things down. Let's start with the healthcare issue. We talk quite a bit about it on the show, but in the last week or so, we've had doctors in increasingly rare and unprecedented quantities coming out warning people about conditions, overcrowding, understaffing in BC hospitals. A 12 physician-signed letter at BC's busiest ER, Surrey Memorial. In the last week, the senior-most doctor in the ER at Surrey Memorial coming out publicly doing interviews saying he would not have his own family attend the hospital, which I think caught a lot of people by surprise. And other physicians that have come out on Salt Spring Island, Saanich Peninsula, Langley, North Island, warning about overcrowding and substandard conditions in hospitals right now coming out of the pandemic and burnout, things that we have talked about in the past. This seems to be building towards a really big pressure point on the NDP government. I want to go around and talk a bit about that. The Premier and the Health Minister asked about this. Why don't we start with you, Jeff? What is changing here on this file kind of in real time with these physicians coming out and speaking, and how do you think that's landing in the public's mind?
Well, I think there's frustration with people who are in ERs and waiting a long time for care. The stories that you're hearing coming out of communities, it's people waiting hours and hours and hours for necessary health care. It's distressing. No one should have to wait that long for care. And kudos to the caregivers for keeping things going at a difficult time. I think that the fundamental issue is, and we've talked about this before in the show, it's human resources, it's people. It's not having the bodies in our healthcare system to keep up with the demand from the public. It's an interesting situation BC's in. I think if you'd asked the health workforce planners in 2010 what's going on, they would have said, we need the money so that we can train the people for the future. And today those same people have the money, and they're putting it into training, but it's going to take years to get people, and they can't find the people. So it's a challenge for the government. I would note that the government is currently negotiating with hospital doctors on contracts. And so what I'm hoping is that as a result of those negotiations, we'll see some progress like we have on the doctors deal, which saw a big lift for family doctors and an influx of family doctors. And on the issue with the contract with nurses, where they established nurse-to-patient ratios, which will mean more nurses providing care for fewer people. But it's a big challenge for the government. There's lots of frustration, and it'll be interesting to see how they navigate this challenge in the days and weeks ahead.
It is a good point. The hospitalists, which are kind of the internal all-purpose doctors that are in hospitals, they are, as you mentioned, Jeff, negotiating, and that appears to be the key issue at Surrey Memorial and at Langley as well, according to the Health Minister's response. So there is that dynamic happening for sure. Allie, what do you think of all this? It seems rare to have this many doctors in this many places coming out publicly. They worry and they express their worry about reprisal for speaking out publicly. How serious is that, and what should people be taking away from that, do you think?
Let's not forget that we're in competition with other provinces to get doctors to come to BC as well. And so when this is making headline news and the number one topic in healthcare right now, if I'm a young doctor trying to figure out where I want to go in this province, if I'm fortunate enough to be that service provider, then I'm not coming to BC. And so what I really hope here is that the NDP are able to navigate this in a way that we will be able to come to a solution, because at the end of the day, if this means less doctors coming here because they're not respected and heard, then we have a people problem, to Jeff's point, in recruiting the amount of doctors that we need. The other point I want to make here is that we have to stop being afraid of this private healthcare word and canceling it immediately. Our dentistry, our chiropractors, our naturopaths, these are all private doctors in a sense. And this is another solution, but the conversation never really gets off the ground because there's such a negative connotation with the private healthcare solution.
Mm-hmm. Yeah, it does, especially with this government. That conversation just, kind of ends before it even starts. But I notice that it is something occasionally that BC United tries to raise in a kind of in a difficult way, given the sort of environment of people's willingness to talk about, our universal public health care system. Jillian, what do you think of this?
Well, I think it's troubling. I think, Jeff made really good points about the things that the government can do to sort of continue staffing up the healthcare system. That's going to take time. I think in respect to the Surrey situation in particular, it seems like there's a really big disconnect between the health authorities and the doctors in the hospital. And this is coming at a time when we really can't afford to have any inefficiencies in the system. The doctors felt that they needed to come out publicly because they, for some seems like relatively simple things, like they weren't allowed to have a poster up advising people of wait times. They're upset because they haven't been able to include instances where they were understaffed in patient records, these sorts of things. So it seems to me that there's a disconnect between the health authority and the doctors. And that's something that could be addressed right away to sort of make sure that people at least are not operating under undue stress in a situation that's already really trying for them.
Mm-hmm. The health minister has faced that question because doctors view those two examples that you just gave as a kind of efforts to silence them in a way, or reprisal when they speak out or try to do something. They have this middle management or senior management at Fraser Health kind of come after them a bit. And the health ministers had to say, no, we're not muzzling doctors. We're not trying to muzzle doctors. But that has blown back a little bit politically on the government. Jillian, I want to stay with you on this, though. We've danced around this, and Jeff's talked about the long-term plans of government here, the new med school, nursing spaces, foreign credential training. It's going to take years to see the results of that. How does government balance that with the short-term frustration from people who I think legitimately are asking the government, can't you do anything now? Is the only solution to kind of grin and bear this for several years in hopes that what you have started now bears fruit years from now? That pressure within government, what do you think that is leading to or maybe causing within government as they get hit by these kind of increasingly bad news stories in this healthcare file?
I think the government's in a tough position because they want to be publicizing and defending all of the things that they've done, which has been, especially in the last year or two, quite a lot. But, like you said, these things are going to take a while before they actually have an impact, especially because of how long the training takes for healthcare professionals. I think looking at, if we're experiencing these problems, especially within emergency care and acute care, what are other things the government can be doing to make sure that people aren't getting to the place of emergency so often? Is there more that we can be doing to help keep people healthy and help take the pressure off the hospital system so that, perhaps, people are getting healthy before they get to a point of crisis? I think that's one thing they could move to. There's lots of social determinants of health we've talked about a lot on this show. Is there anything around that they could do that would make a difference in the short term? Maybe it's time to look at some of that sort of stuff while the longer term healthcare policies come into effect.
Mm-hmm. I sort of wonder if it's going to push the NDP government into making kind of, announcements that might not do anything or aren't even announcements, but just to kind of, address that public criticism. We're seeing it in cancer care, for example. We talked on a previous show about the cancer care delay times, having to go to Bellingham for cancer care in a new government program. Well, in the last week, Adrian Dix has approved concept plans for new cancer care in Nanaimo and Kamloops. Concept plans, not even business cases. There's no budget attached to it. There's no timeline. They're just concept plans, which, you know, the New Democrats in the past have kind of said, you announce things with business cases, not before that. And I think that's an example of government getting hit in a part of the healthcare file, feeling that pressure, and then starting to announce things they might not otherwise normally announce because the long-term plan is going to take years to show any type of change on that. So I'm kind of watching on that. Allie, I want to go back to BC United. Kevin Falcon says, and he said this before, maybe the solution here isn't more money. And the NDP have added $10 billion to the healthcare budget since they came into office, have hired thousands of more people. He said if money was just the solution to this, it would have happened already, and that you have to do something different within the system. Do you think that argument is going to continue to hold when you have doctors coming out and saying, we need more doctors, we need more money, or how do you reconcile kind of the opposition's position there, do you think?
I think the point there being that we've had record investment in healthcare. Thank you, NDP government, for that. And also just the circumstances of the last 5 years and a focus on healthcare. But we've thrown the money at the problem, and it's still not creating much of the solution. I think here, though, for any political party, it's really just listening to those who are the experts in the solution. In one article I read this week, in trying to figure out what's going to solve the emergency room healthcare issues, it's that doctors aren't even allowed to send patients to alleviate the wait times within the emergency room to the specific department within the hospital without having to go through that like 24 to, in some cases 48 hours of being and waiting in the emergency room first. And so there are some solutions here, and is the point that I'm trying to make, in that there's policies that help doctors help patients. And that's the case where that's not money. That's just sitting down and listening to them and trying to figure out how we do a massive overhaul of healthcare. And it's easy to say, let's just do a massive overhaul of healthcare. But that's really what this problem needs, is a champion. And I'm hoping that that's our Minister of Health, Adrian Dix, right now, in that he can be that. But that is what we need, a champion that's going to listen to doctors and nurses and everyone in these small solutions, because they're the experts, not us.
Mm-hmm. Jeff, what do you think? Money, small solutions, long-term progress, that political pressure, that dynamic, the doctors speaking out. How does the government wade through all of that?
Yeah, there's things government can do right away to make things better. I've seen the government waive fees for internationally trained nurses who want to come to BC, or people who want to come back to practice. That's like $3,000 or $4,000 incentive. So that's something that can make a difference now. Getting pharmacists to do more expanded scope of practice, minor ailments, and contraception prescriptions. So that's taking some of the pressure off of ERs now. And there's always going to be things that we can be doing better in the health system. And Allie's talked about some. I always get worried when I hear politicians say money's not the issue, because when I hear them say money's not the issue, then that says to me that they're not planning to invest money into an issue that requires money to be invested, and maybe they're going to put that money somewhere else. So, I mean, that will be the challenge. We were talking about Mr. Falcon and where he's on these issues, but it's a big file, and whether it's Dix or whether it's someone else in the future, hard slog, lots of work to do for years to get us to where we need to be.
Mm-hmm. Okay, let's change topics to international trade. The Premier heading out on his first overseas trade mission. He's going to Singapore, South Korea, and Japan. Sometimes, and I know the NDP in the past have called these trade missions junkets, travel junkets for politicians. They get to go and do a bunch of photo ops and come back with, not much to show for it. Maybe some sister city agreement type of thing. The Premier now saying this is an important time to do this with international relations with China and Russia, obviously causing supply chain problems. BC's mineral resources needed for solar panels and electric vehicles in high demand, and our traditional export products of wood and copper and that type of thing. So Premier is very stoked about going on this trip. I talked to him about it this week. He thinks things will happen. Is it a junket? Is it a trip? Can it be both things at the same time, I guess, depending on which side of the political fence you're on? Jeff, let's stick with you on that.
Yeah, I could see folks at home who are looking at their rent bill or their mortgage and saying, is this really a good use of money? And I think anyone who's ever worked in a political opposition party has written the news release, it's time to junk the junkets, right? That's just like a rite of passage. But trade missions are important. They can boost economic growth and expand international investment in BC. We've got a good story to tell, and you've touched on the products and services that we're known for. But I want to take this back, and I want to say that this travel is not glamour, right? Does anyone here think that this kind of work travel is fun? Well, of course not. Don't be ridiculous. Picture yourself. You're a 6'7" premier. You got to travel 10 hours to Japan, 2 hours on the front end, 2 hours on the back end, 16-hour time difference, so your internal clock is shot. You're away from your family. All your routines that keep you grounded and healthy are gone. Different food, different beds, always on. Pressure to deliver thanks to shows like this high. This is no fun. So if I'm a politician, I would like to junk the junkets, but it's important for the economy, important for investment, I think.
Mm-hmm. And Eby's going to get stuck in economy class too, because we have this sort of.
Can you imagine him in an economy class seat? That's got to stink.
Yeah, especially the person who puts the seat back in front of him and just hits his knees. Yeah, we don't. The public doesn't allow politicians to fly first class, even though we expect them to jump off the plane on the other end and immediately into work. But anyways, Allie, what's your thought on this? I know, like from a communications point of view, the other challenge is the government needs to show some sort of progress there and not bore the public, but it doesn't also want to show what would look like the premier having a holiday in front of landmarks. So you get these boring kind of grip and grins with dignitaries like the governor of Tokyo, which the premier is planning to meet, and the public doesn't think this was worthwhile at all. So you're kind of stuck in that position too.
Yeah, I don't think people would necessarily mind it or focus on all of the potential communication blunders that could come from these sort of trips where all eyes are on our politicians, as long as you come back with something to show for it. So, spend all the money that it takes, but you have to come back with something. So something that I'm going to be looking at is the fact that one of our major exports, of course, will be potentially LNG. And so is this a potential where he comes back with a good deal for us? Spend all the money it takes for that to happen. But you got to come back with something in order to pay for all of that.
Yeah. The premier is meeting with Mitsubishi, which is a partner, I believe, in LNG Canada. So he is going to have to talk about LNG, even though I think he's preferring to talk about hydrogen and Ballard's kind of fuel cell BC hydrogen connection rather than LNG. But I think that's an ideological thing for the New Democrats and for this premier when it comes to LNG. Jillian, what do you think? Junket, worthwhile, difficult for government to navigate?
I think they are important. BC relies a lot on exports. We have a major port. I think BC is the closest seaport to Asia in North America, so it is really important. But it's also really hard to measure success on trips like this. Because a lot of the time they're about long-term relationship building. So it is really important to, go over, remind people of all of the things that we have to offer in BC. But often these relationships take a really long time to bear fruit. It's really difficult to quantify. So that's the challenge. I think, we've seen, especially at the federal level in the last couple of years, how leaning too much on the communications aspect of these trips can have a really negative effect for government. The Prime Minister has had a lot of gaffes and unfavorable sort of photo ops and things like that. So I think that the BC government has probably learned from that and is going to be focusing more on the business side of the trip. I'm not sure, that we should be expecting anything too concrete. Perhaps we'll see something specific with respect to natural resources, but I think as it's hard to quantify, but it still is important.
Mm-hmm. Okay, let's just squeeze in one final topic here. We only have a minute or so, but BC United, new advertising campaign, trying to get that brand out of the former BC Liberal Party. We're going to show some of it here just in the background. Kevin Falcon walking through a forest, talking about BC's diminished stature, talking a bit about his plan. This intended to get that branding into the public's mind, and that idea, that messaging he keeps saying about providing results, not rhetoric. Just quickly go around here. Good, bad, corny, effective? How do you think this new advertising campaign is landing? Jillian, start with you.
Yeah, I thought it was interesting. It's definitely a shift in strategy in terms of messaging. The Falcon talking about how, the NDP is thinking too small and we need to be thinking bigger in order to sort of address all of the problems that the province is facing. And I think that that's so fascinating because traditionally, BC United, former BC Liberals are more of a small government party. Falcon's sort of been trying to run on this issue, building on some of his record, building things like the Port Mann Bridge. I'm not sure it's going to land. It's such a big shift. They need to be doing something different to get ahead of the polls, but I'm not sure that it's consistent enough with public perceptions of his party in terms of where they're already at. Yeah.
Okay, Allie, 30 seconds. What do you think?
Political parties have to do this. It's not even just that BC United had a new rebrand and the new logo launch. That there needs to be like two streams for all political parties in advertising and getting their word out there, and that's the positive messaging and the contrast messaging. And so I think you're going to see a lot of that in the next year, certainly as we lead up to the election. But it's not just election periods that you should see these sorts of advertising. You should see them year round.
Mm-hmm. Jeff, final word to you.
It's the same first ad every politician has ever done. Aren't things bad? Things will be better if you vote for me. So it's fine. Who I feel bad for is the viewers at home. They're trying to watch the upside in America's funniest home videos coming up after Political Capital here on CHEK, looking for some good news, and they've got to deal with the downer Kevin Falcon, talking down BC. Come on, let's just.
Is America's
where's the
funniest home
positivity?
videos?
Where's the good news?
Yeah. Hey, look, great ratings for America's Funniest Home Videos. It's a popular show, so hopefully we didn't ruin
show.
that.
It's fun. Upside. Good news stories in Victoria. It's good show.
All right. Thank you for watching. Thanks to the panel for being here. As always, make sure you subscribe. CHEK Plus, Political Capital on your podcast device, or here Sundays on CHEK TV. Thanks so much. We will be back next week with all the latest here on Political Capital.